We're having a day of joy, aren't we? So it's not going to be too miserable, don't worry. We're not going to get stuck in the nitty-gritty of why everything's so horrible. We're just going to talk about why it's hard, and then we're going to talk about what we can do about that. So I'm Rachel, I'm a GP in Hawthorne Medical Centre. I've been there for a while, I've been the safeguarding lead for a while. So we've picked up a few things, as I'm sure most people in the room have really. But just looking at what's going on at the moment. So what we do, if we look at safeguarding at the moment nationally, we're seeing before COVID happened, safeguarding was going up, and it sort of had a big dip in COVID, and then it was a big spike after COVID, and then since then it's kind of levelled off a bit. So it's like, what's going on? Is that okay? But what we are seeing are these things called Section 47 inquiries, and they're going up. So if you're new to the world of safeguarding, a Section 47 inquiry is when one of us will ring social care and say, we're a bit worried about this kid, and they'll go, yeah, that's significant. We'll go and have a meeting with the police, which is a Section 47 inquiry. So they're actually going up quite a lot. But what is happening is the rates of those turning into a safeguarding case or a child protection conference is dropping. So they're actually at 34% now. So if, like me, you're ringing up safeguarding and saying, I'm really worried about this, often they just say no, it doesn't meet the threshold to start with. But if they do take it on, it goes to this Section 47 inquiry. But only 34% of those are actually going into a safeguarding plan. So the rest are all being given back to us and to places like Early Help, which are optional for parents. So what we're seeing is actually there's quite a lot of safeguarding worry, but not a lot of ongoing social care support around. And on the back of that, these are nice statistics from various places I can give you if you want them, but we're seeing actually offences for child neglect and cruelty going up. So there's probably a lot of safeguarding going on, but a lot less intervention from social care, which kind of puts it towards us really, puts it a bit more in our area of work. And part of that is because there are lots of funding cuts across social care. We've seen there cuts across interventions quite a lot, and what that's led to is a change in social care patterns of work. So they're a lot more focused on intervention in certain areas than they are on the supportive side. And that's because when your budget's short, you really want to make sure you don't miss the big things, but there's less cash in the system for ongoing long-term support actions. So obviously, a big driver of that is poverty. So poverty and safeguarding really closely linked. I'll put that slide up, partly because, so these are the 10 in the Northwest, these are the most, they've got the highest levels of child poverty. So in the whole of the Northwest, they're MP constituencies with the highest child poverty. And I put this up because we're studying number one. So these are from GM Poverty Action, these stats. So actually, if you walk out the door, the average rates of child poverty are 51%, which is a bit crazy when you think of it. Every other child living in this neighbourhood is living in child poverty. Our surgeries in Russia, Manchester, Russia, so we're in number 2, which surprised me as well. But I think that's due to a lot of inner city issues and a lot of ethnic minorities as well, because there's high rates of poverty there. So we're seeing these crazy numbers. Just for comparison, the child poverty rate in Altrincham in Hale is the lowest in the Northwest, and that's 14%. So massive inequalities there. And why does that matter? As I said, we see those numbers going up in ethnic minorities and people living with disability in their household, disabled parents, and other adverse childhood experiences going on. But that matters because these children in the most deprived areas are 13 times more likely to be on a child protection plan. So where you have poverty, you have more child protection. And what we end up seeing are these sort of cycles of poverty where vulnerable families are sort of driven further into poverty sometimes due to cuts in their local services, and therefore they're having more of an impact on mental health, and that can lead to problems with alcohol, depression. We see it quite a lot in surgery, don't we? These cycles of poverty that lead to getting the right support in place for people, but also all the issues that are associated with that our focused care workers are so good at dealing with housing and jobs and benefits and getting the right support to the right people. And I think one writer, he said the most important factor in avoiding abuse or neglect in children is to have a parent who has the capacity and ability to parent. Some of these numbers come from some social care research that's gone on, and they've looked at it and said, actually, if you have a parent who can parent well in a good capacity, then you won't have any, well, not any, but you will massively reduce your safeguarding rates, particularly around neglect. And that's where the poverty comes in, isn't it? Because if you're living in poverty, you've got high rates of mental health, you've got more drugs and alcohol, you've got a lot less support going on, and we're seeing a lot more safeguarding going on, sadly. And then there's another factor, which is a bit of an odd one, and it's called the inverse intervention law, which I'm going to find a video about.
What on earth is the inverse intervention law in child protection? Everyone knows child abuse and neglect are linked to poverty, so why go on about it? In actual fact, there's little recent UK research on the family circumstances of children who are abused or neglected. There's no government data, and child protection policies don't focus much on things like poverty, debt or housing. So maybe we don't know. Did you know how much greater a child's chances are of being in care if they live in a very deprived neighbourhood than if they live in a very rich one? The answer is about 12 times greater. 12 times. If a child lives in an affluent county or wealthy suburb, they are much less likely to be in care, separated from their parents or on a child protection plan. Around 9 times less likely in Wokingham than in Blackpool, for example. This isn't a random lottery. It's unfair. Shouldn't such inequality be prevented? Poverty and child abuse are clearly linked, but that's not the whole story. There's something interesting we've called the inverse intervention law. Affluent areas, which we will call county shire, and disadvantaged areas, which we will call city borough, are made up of a mix of neighbourhoods. In county shire, there are some deprived areas, and in city borough, there are patches of affluence. So what if you compare similar small neighbourhoods in county shire and city borough? Are there similar proportions of children in care or on child protection plans? Surprisingly, the answer is no. If you compare equally deprived or equally affluent neighbourhoods within both county shire and city borough, the county shire neighbourhoods have much higher numbers of children in care or on child protection plans than city borough. That's true across all levels of deprivation. Why is this? We've got some ideas, but we don't have all the evidence yet. A new project is finding out. Does it matter? If the rates in all county shire neighbourhoods were the same as those in city borough, the numbers of looked after children in the county shire areas would be reduced by almost half. However, it may be that rates in city borough are too low rather than the rates in county shire being too high. Who's getting it right? It's a major concern that we just don't know which approach produces better outcomes for children, and we can't yet explain the inverse intervention law. Perhaps we need some rocket science.
So they've actually looked at this over the last couple of years, and there have been some changes to social care as a result. Oh no, I've gone far too far now. Ignore me. Where were we? So what they've actually found is when they've looked at, they've done similar research across the world, and they've actually discovered it's probably more of an income inequality intervention law, which rolls off the tongue, because in other countries they found this gap, but not necessarily in the lower depth of poverty we have. But actually anywhere where you've got inequality in a society, there's more intervention in the lower end than there is in the upper end. And they've done quite a bit of research trying to figure out what's going on there. And there's two main conclusions really. One is this, that the belief that those in poverty are somehow to blame for their circumstances and the prejudice this creates amongst professionals working with them. So it's people like us and how we are judging those patients that maybe bring those changes, which is a challenge really. And I was thinking about this, thinking, well, we're really great. We're all here because we care. But there is still, we judge people, don't we? And I think across my practice and how the receptionist is with the patients, and if somebody comes in and they're a bit shouty and they're a bit, you know, in their face, how good are we at not judging them? How good are we at seeing past that? But this is for all professionals, and this was particularly aimed at social care as well. So I think we've still got to be a bit introspective and think about how much do we question parents' life choices and things like that. Because when they've looked at this, the people they spoke to, the families involved, talked about these emotional microaggressions of poverty that they see every day. And that can come from government attitudes, policies on benefits and all sorts of things. One of the reasons why poverty's gone up so much in the past 10 years is because of the two-child benefit cap and the benefits cap altogether. The two-child benefit limit and the benefits cap. And these policies that sort of almost continue the narrative that people somehow to blame their poverty, you shouldn't claim benefits, and how that outworks in the system can sort of develop a real hostile environment for parents navigating day-to-day challenges and trying to feed their children, trying to talk to school about the school meals or why their child's not got the right shoes on. I was thinking about this last week. My kids got these shoes are all tatty because it's the end of June, and I'm like, so I'm not buying any new school shoes. We do that in August, and it'll last a year. And he's just getting away with it. And I'm thinking, actually, if a kid in a poor background came in with tatty shoes like that, I wonder what people would be saying, it just made me think about how we judge people a little bit. So we could have a think about that. But the other area they found was more of this power imbalance that leads on from that, really. So a power imbalance in society and the mistrust that causes in deprived communities. Because what that leads to, obviously, if we don't have a great relationship with those people we're looking after, they're not going to ask us for help. They're not going to seek support if they're in a situation of domestic violence or they can't feed their kids or there's a crisis because they don't trust us, because they feel judged. So we need to sort of really build those relationships with our deprived communities, don't we? So that's all the miserable area we're at. That's why it's bad. That's why we're at the deep end, because even if you're in a deprived community, if you're in a deprived community in a deprived area, like we are here, then your rates of child protection are massive compared to working somewhere lovely and sunny. But there is stuff that they recommended that we can do about it. So the recommendations in some of these reports are around, first of all, on that point about judgment. So making sure, and I think this is for our teams as well, that we are using reflective discussions. Again, this is aimed at social care to a certain extent. We don't really do supervision as doctors. I think sometimes we should to try and get some of these issues out. But addressing any unconscious bias we've got, because I think we've probably all got some ideas. I know I see a patient name on my screen and I'm like, oh, and it's how that reflects in that relationship. It's an interesting one, isn't it? Understanding the impacts of poverty from a person's perspective, really, and how that's actually going to affect their day-to-day lives. I think, again, we probably know some of our patients are a bit on the breadline, but how are they feeding their kids? What are their pressures at that time? And then as clinicians, that's going to help us sort out the physical and mental health problems as well, isn't it? And then this power imbalance. So this was the quote they came up with. It's basically good medicine, isn't it? It's good practice. It's taking time to build trusted relationships, empower people, and help them make their own decisions. Because in that, they will be able to safeguard themselves better. They'll be able to seek help when they need it, and they'll be able to work with us to help them. And I'm thinking particularly, we end up in these cyclical situations of child protection at the moment, where things will get better, they'll go on a plan, and domestic violence will stop, and the house will get better. And then 2 years later, we're back in the same situation, and it's trying to fight, but the second time round, they don't really want to tell us, and it's all hidden, it's a bit more cloak and dagger. And it's trying to find ways to walk with people through these situations without some of that judgment. And look at the big picture. So the report that came out with some of this research concluded, and again, this is oriented at social workers, but often in our day-to-day practice, as we become immersed in the micro level of society through our work with children and families. While this is important and useful in relationship-based practice, it can lead to individualising problems without considering the macro content of the society. Knowing the needs of children and families intimately, but then also seeing the wider organisational or societal perspective is both challenging and important. So some of this came about because when they looked at the child sexual exploitation things that were going on in Oldham and Rochdale, they found that a lot of social workers knew what was going on with each individual person. So they knew a young person was being exploited, but the blame for that was on the young person. There was victim blaming on them, and then there was pressure on the parents. So it's like, well, actually, there's just bad parents, and that child's just acting out. But only when they took a step back and they saw this pattern was repeated over sort of several areas in several children, would they say, hang on a minute, we just step back from just looking at this person and how bad they are and how bad their family is and what we're going to do with them, and looked at the wider patterns in society. Could they say, actually, there's a pattern developing here, and there's something different we need to do to sort of get to the roots of the problem, really. So that's reflected in what they're doing. So actually in social work now, they've developed a social model of child protection and poverty-aware practice based on this. So they're trying to themselves become a little bit more poverty-minded and understand some of these big pictures, which I think must be really hard in social care, because you are the one who has to ultimately make some of these decisions about the future of children in an emergency. But they are trying to go more that way. And then be an advocate for change, because in all these, everyone keeps saying there's an election next week, it just highlights more and more inequality, doesn't it? And actually, if we can do something about that poverty rate, we can lift a load of children out of child poverty by making political changes, but then we can also lift a load of children out of safeguarding and looked after care. And it's not rocket science, is it? All that video said it was. Yeah, we've got to vote, haven't we? But also engage with anything else that's going to help us. So, what can we do? Because the research talked about, actually, if we can help a parent better, help them be mentally well, physically well, and more stable, that can be an incremental change in a child's life. Every intervention we have can have a positive outcome. So I think even when we're doing the postnatal check and we're checking in, mum might be a bit depressed, we'll talk to her, we'll sort that out, and we'll see her again, we'll check she's okay. Even these little interventions we're doing every day, doing good medicine, are having an impact. But just being quite aware of the consequences of our actions and going after people, because I think it comes back to the basics, like we said, it's care and compassion for our patients, isn't it, really? Looking for root causes. So they found, so when they've looked at there's lots of statistics, but 50% of children on a child in need plan actually have domestic violence in the background. And actually, how much are we going after those root causes? So when we get a call, or we're worried about this child from school, do we know what's going on in that house? Do we know, is there any domestic violence there? Is there alcohol abuse? Is there drug abuse? What's going on really? And trying to think big picture, as they talked about. Look for provision to meet needs. So this is really hard because I know in our community often trying to find what's going on, it changes so quickly. So support for parents is there 1 minute, 1 minute it's not. And also there's been a lot of austerity type cuts, but there is support out there, just finding the right support for the right person. A lot of this is good focused care. If you've got a focused care worker, they're the people to go to. But it comes back to building these relationships, both with our patients and with other people. And I'm finding now more in my practice that actually I spoke to a teacher at school every week for the past few weeks, because they're ringing us up now and saying, what do? We've done this child protection thing, and Mum's been to early help 3 times, and she doesn't want to go back to them, and she's refusing that referral, and we're worried. And I'm saying, yeah, I'm worried too. So I'm having conversations that I didn't used to have, because it feels like the traditional sort of ways of child protection aren't sort of catching people anymore, or that threshold is just so high, and these people are just stuck in the cycle. And years go by, and actually one family, they're not kids anymore, they're actually 19, 20, and I'm looking back, I think that's been their entire childhood, has been this cyclical child protection, sort of low-level intervention going on. So we're talking to people differently, but so building MDTs where we can. And obviously the question is, how on earth we do this when we're seeing our patients, and how we fit everything into our day, which is our eternal challenge. But as we said before, it comes back to everyday care and compassion for our patients, trying to look beyond what we see and see where we can make a difference. Because we do have the opportunity to make significant differences, really. So just as I was writing this last week, I got a call from the school, so I thought I'll just briefly have a look at this. So this is a little girl, the teacher rang me to say they're worried about Ruby. I've known Ruby for years because she's one of my cyclical patients. She lives with her mum and her older sister. School attendance was 14%, and she came dirty, smelling. She was teased by the other children because she smelled of wee. And the school's relationship with mum is completely broken down. On both sides, I would say now. So they haven't got a lot of compassion left for mum. And mum has a jumper that she wears to school that has swear words on the back. And she's got one of those dangerous dogs. It's an XL bully, which she has had licence and has all the checks, but I do wonder if she's got it just to annoy school sometimes. So they've had a complete breakdown of trust. And this child's already been on a child protection plan. And the school have referred twice again now, and they've said she doesn't meet the threshold. So we're kind of a bit stuck, and they're saying, we're stuck, what should we do? And they do come and see me, so I've got quite a good relationship with mum. So we're trying to work through some of these issues. So I'm going, in fact, this is my meeting on Monday, I'm going to school with mum, because mum will talk to me, but she won't talk to school. We're going to try and figure out some of these things. But looking at some of the things we've talked about, I know the roots of this situation are that Ruby, I'm pretty 90% sure she has autism, and if not ADHD as well. So last time she was in my room, she was on the floor growling, pretending to be a feral dog. She wets the bed, but she has sensitivity issues around water, so she won't wash. So I'm not at all surprised she goes to school smelling of urine, because she will not wash. And I've heard her, I rang mum once, and she was trying to wash this child, and it sounded like something horrific. So I've also seen them lying on the floor in Sainsbury's having a tantrum and ran away actively, because I thought I don't want to have that conversation today. So she's got massive sensory needs, this child, but I spent about 3 years trying to get her into CAMS. So CAMS seemed to lose our first referral, and then the second and the third, they sent questionnaires to school and mum, and neither of them sent them back. So mum most definitely has ADHD herself, and she's got massive levels of anxiety and some mental health. So she's completely disorganised and could not fill in a form if they sent it to her. the last time we sent the referral, we said, just send it to us, I will get that form done. But schools are not filled in the form. So she's now on a fourth referral to CAMS. And then we got a letter through from CAMS in Manchester saying, GPs can no longer refer to CAMS, it has to come through school. So as you can see, that's really not going to happen. So for 3 years, we've been trying to get this child into CAMS. She got an urgent appointment in February, and mum DNA'd. I was like, oh! So there's all this, there's lots going on in the background. There's mum's mental health. This child has needs, but school don't really see them because she's not there very often, quite frankly. But also, when she's there, she tends to probably mask a little bit, and they've not picked up on things. They've picked up on a bit of bullying because the other children say she smells. They're also living in poverty. Mum has decided to become some kind of pet rescuer, so the house is full of all these animals. But this mum's a great mum. So she really cares about her kids, and she's one of these, I'll go to the end of my earth for my kids, I'll do anything. You see this iceberg of school going, well, what's going on? But underneath, when you start to unpick it, there's so much going on that we can support with. She's getting very little food. She's also got swollen bones in her joints, so she can't carry food back from the shop because it hurts her hands. So she's getting deliveries, but she can't afford deliveries. And you unpick it, the levels of sort of poverty, mental health, unmet childhood, neurodiversity, and school can't quite get to that depth, mainly because mum won't talk to them. I've got a lot of respect for the school because I think they really have tried. So these are the sort of situations we sit with a lot now. And I guess there was a question of how much a GP gets involved in all this, isn't there really? But particularly in this family, I don't think there's anybody else. There's only us and there's only school involved. So that's an interesting one. So before we get a bit too depressed, why we bother? And we talked about we can make a massive difference. And as I was thinking about some of these difficult situations, I thought about some of the positives that we've seen over the last year or two. And there are loads of them actually. Every intervention that we make can have a massive difference in all these areas. And these are just ones that came into my head over the last couple of years. That we have had children removed. We've got 2 sets of parents in jail, but those children are now thriving, and that was the best outcome for them. But we've seen so much positivity, and it's really nice when you see a family, isn't it, when you walk through domestic violence journey with them, and then they don't come in after that, but then a few years later they come in because, Jimmy was playing football and he's done something to his foot, and you realise that they're just healthy, normal families now. They don't need to come and see us all the time because that level of intervention is passed. And you do see some amazing outcomes with time, which is why we bother. And this was one of the studies I looked at around some of these inequalities. This was their sort of take-home message, that we root our practice in the voices and experience of those who are struggling to live, love and care in conditions which make it difficult to do so with dignity and respect.